students in Boston will be wearing masks in the fall. So joining us right now is Dr. Simone Wilds, an infectious disease specialist at South Shore Health. Dr. Wilds, it's always great to have you. Thank you for joining us. So let's start there. Do you think that a wider change in protocols is needed?
I really support what Mayor Janey has said, that I think as we try to get the students back to in-person learning, I think we want to have them wear masks, everyone, regardless of their vaccine status. The important thing, though, is it's not only universal masking, but we also want to make sure that there's testing availability, there's also proper cleaning and disinfectant, vaccinations for those when it's available, and proper ventilation. Really important. We want to keep everyone safe.
Doctor, the Washington Post is reporting that the White House is now reconsidering mask guidance, but it's just not clear right now what form that would take. So for people who are going into the office every day again, or for people who have been coming into the office every day since the beginning of the pandemic, what's the risk right now?
Maria, everyone is talking about this, but I am going to stick with the CDC guidelines, which says if you are fully vaccinated, then you do not have to wear your mask. Of course, there are certain exceptions with federal, state, and local entities, and of course, certain workplaces, such as the hospital, we still wear a mask. However, if you are not vaccinated, you need to continue to wear your mask. And if your immune system is compromised, you want to continue to wear your mask to protect yourself.
Dr. Wilds, today the director of the CDC said, and these are her words, that the U.S. is at another pivotal point in the pandemic. She implored people to take the Delta variant seriously. It's a pretty strong message from Dr. Rochelle Walensky. So how worried should we be right now?
Firstly, I do support strongly what Dr. Walensky has said. The Delta variant really has been very concerning to all of us. And the cases have been increasing not only in Massachusetts, but across the country. I think the key takeaway that I want to stress is for those that have not yet been vaccinated, please get vaccinated as soon as you can, because where we see the cases of Delta variant greatest is where the vaccination rates are low. So get your vaccine, not only to protect yourself, but to protect your family. Remember, vaccine saves lives, and we want to make sure that we keep everyone healthy and well and enjoy our summer.
Dr. Simone Wilds, an infectious disease specialist at South Shore Health. Doctor, thank you so much for joining us, and thanks for all that information. We always appreciate it.
Thank you.